An 8-year-old girl presents with chronic productive cough and recurrent respiratory infections over the last 3 years. Despite numerous courses of antibiotics, her symptoms persist. High-resolution CT, HRCT, scan of the lungs reveals dilated bronchi with thickened walls. Family history reveals her mother had similar issues diagnosed as bronchiectasis in her late 20s. What is the most likely cause of her condition? A. Asthma. B. Cystic fibrosis. C. Primary ciliary dyskinesia. D. Common variable immunodeficiency. The correct answer is B. Cystic fibrosis. This patient's chronic symptoms of productive cough, recurrent infections, and the HRCT findings are characteristic of bronchiectasis, which in her case is likely due to cystic fibrosis. This condition impairs mucociliary clearance, facilitating the vicious cycle of infection and inflammation leading to airway damage. The family history further supports a genetic basis common in cystic fibrosis. For more detailed cases and medical concepts explained, follow and engage with our ongoing educational series. Your insights are valuable.